And on this particular project, we assessed the effect of a vitamin injection prior to farrowing given directly to the sows on the antioxidant enzymes as well as growth performance of the subsequent offspring. So the particular vitamin injection which we utilized was the combination vitamin injection, a commercially available product that included vitamin A, vitamin D, as well as our primary vitamin component of interest, vitamin E. And as we know, vitamin E is a cellular level antioxidant, which through various antioxidant enzymes pathways is also linked to selenium, manganese, as well as copper and zinc. Dr. Mahan, as well as other research by other researchers around the country and throughout the rest of the world, has shown that there's minimal placental transfer of vitamin E from the dam to the neonatal offspring prior to farrowing. And additional research has shown that once the newborn piglet is born, in many cases they are deficient of vitamin E because of that minimal placental transfer. Therefore, it's just another reason why colostrum is so critically important to get into that newborn animal as soon as possible. Supplementation of vitamin E in gestation, lactation, as well as early nursery diets has been studied quite extensively, whereas the impact of a vitamin injection given directly to the sow on subsequent offspring performance was less defined at the time of this project. Therefore, the overall objective of the study was to evaluate the effect of a 5 milliliter intermuscular injection of Vital E Repro given a week prior to farrowing on day 107 of gestation on nursery pig antioxidant status as well as growth performance in the nursery phase. And as I mentioned, the vitamin injection which we utilized was Vital E Repro, a product of Stewart Products, and included a vitamin E, vitamin A, as well as vitamin D3. So porcine epidemic diarrhea virus, I'm sure we're all well aware of the great major impact it's had on the swine industry over the past 2.5 years in the United States. And at the Michigan State Swine Farm, we were not immune, or we did not have the fortune to avoid keeping the virus out of our facility. And the virus first entered our facility in late January of 2014. It originated in a couple of the nursery rooms and quickly spread throughout the rest of the farm at this time. Once we were clinically diagnosed with the virus, we immediately began a feedback program to infect all sows and gilts in our herd. This trial was conducted in late August through October of 2014, so approximately 8 months following the initial disease outbreak. But I would like to point out that at the time the trial was started, there was no clinical signs of PED, and we have no reason to believe that the virus was causing any health challenge or any issues with the sows or offspring at that time. It was part of a larger study, which I worked with my colleague Roel Becerra, also on an undergraduate research project, in which he evaluated the number of live-born piglets, piglet survivability, farrowing time, as well as long-term performance of those offspring. And a little bit of background in why we thought about using this vitamin injection relative to sows which had been previously exposed to the PEDV virus. And some of the field-based research from veterinarians in the field has suggested that sows, when given this vitamin injection, may have a reduced farrowing time as well as lower incidences of stillbirths. So that was the portion that my colleague worked on, and whereas I looked at the antioxidant status and growth performance of the offspring following the farrowing and the lactation phase. So our trial consisted of 2 treatment groups, the first of which was our vitamin injection group, and this group of 11 sows received a 5 milliliter intermuscular injection of Vital E Repro, whereas our control group sows also received a 5 milliliter intermuscular injection of saline, also on day 107 of gestation. For my particular portion of the study, we used 12 barrows, 6 of which were from each treatment group, on a study through 45 days of age. At weaning on day 25, the average body weight was roughly 7.2 kilograms, at which point they were allotted to nursery pens within treatment and where they were given a commercially available starter diet. And we had 3 pigs per pen and 2 pens per treatment for the nursery portion of this particular trial. And I'd like to point out that all diets for gestation, lactation, as well as our nursery diet were all formulated to either meet or exceed the NRC requirements, particularly for dietary vitamin E. So the major portion of my study was the blood sampling, which occurred initially on day 5 of age, at weaning on day 25, as well as the conclusion of the trial on day 45. Blood samples were analyzed for plasma ceruloplasmin, as well as plasma vitamin E concentrations, whereas red blood cells were lysed, and the total superoxide dismutase activity, as well as the glutathione peroxidase activity, was measured. In addition, we measured the growth performance in the nursery phase, so from day 25 to day 45 of age, in which we measured average daily feed intake, average daily gain, as well as feed efficiency. So as I mentioned, plasma vitamin E was measured, and we sent these samples to Iowa State University Veterinary Diagnostic Laboratory for analysis, whereas the assays for ceruloplasmin, total superoxide dismutase, and glutathione peroxidase I performed at Dr. Hill's laboratory at Michigan State. So to start with, ceruloplasmin is a copper-containing enzyme that catalyzes the reaction of iron from its ferrous to its ferric form. It is an acute phase reactant protein, meaning that it is closely involved with the innate immune system and is produced and upregulated in response to inflammation. It is measured via a colorimetric assay in which we allow a reaction to occur over a set period of time, and then we measure the change in absorbance over that time. Thus, we can determine the activity of the enzyme. Total superoxide dismutase was measured, and superoxide dismutase comes in 2 predominant forms. The first of which is the copper and zinc SOD, and the second is the manganese SOD. And the assay which we performed measured the combination of both forms of the enzyme. The enzyme catalyzes the reaction of the superoxide O2- ion into hydrogen peroxide and oxygen, and it is also measured via a colorimetric assay in which the change in absorbance of light is measured over time. Glutathione peroxidase is a selenium-containing enzyme which catalyzes the reaction of hydrogen peroxide into water. It is as well as a colorimetric assay. So I'd like to take this opportunity to step back a minute, and there's a lot of information up there, and so what does this mean? What are these antioxidant enzymes? What do they do? What role do they play within the young pig? To start with, ceruloplasmin, it involves obviously the conversion of iron from its ferrous to its ferric form, and it needs to be in its ferric form to be loaded on the transferrin enzyme, which allows the iron to be mobilized throughout the body. It also eliminates free iron within the body, which iron in its free state within cells and within the body can cause some oxidative stress and can cause some damage. So that's the importance of the ceruloplasmin enzyme. And I'd like for total superoxide dismutase and the glutathione peroxidase, reactive oxygen species, or ROSs, they include the hydroxyl radical, the superoxide ion, as well as hydrogen peroxide. And these compounds are produced as a part of normal cellular metabolism, regulation of homeostasis, as well as cell signaling. They also play a very important role in elimination of different pathogens within the body and destruction of unwanted cells in the body. So they do play a very critical role in normal everyday cellular operations. However, when their levels do increase too high, they can cause some damage to the host cell. This damage can come in a variety of forms, one of which can be oxidation of DNA, oxidation of various proteins and enzymes in the cell, as well as damage to lipids. And if we all recall, cellular membranes, the main component is a lipid bilayer. So damage to these lipids and these lipid bilayers can either reduce or impair a cell's ability to either maintain or establish concentration gradients for chloride, sodium, and different other ions, which do play a very, very important role in a variety of metabolic pathways. So to summarize this whole slide, reactive oxygen species are very important. However, in excess, they can cause some damage, and some of these enzymes play a critical role in maintaining adequate but yet safe levels of these very important compounds. So moving on to the data portion, I'd like to take this opportunity to set up my next several data slides. On our x-axis, you see we have day of age of the pig, with day 5 correlating to the initial blood collection date, day 25 correlating to weaning, and at the conclusion of the trial on day 45. On our y-axis, we have our concentration, in this case plasma vitamin E concentration given in parts per million. And the red line is the plasma vitamin E concentration of offspring from sows which received a vitamin injection on day 107 of gestation, whereas the blue line represents our offspring from sows which received the saline injection. For plasma vitamin E concentration, we observed a time effect in which the plasma vitamin E concentrations decreased as the pig aged. In addition, we are approaching marginal significance with a p-value of 0.10 for the offspring from sows which received the vitamin injection having greater plasma vitamin E concentrations throughout the measured duration of this trial. Moving on to the ceruloplasmin activity, again on our y-axis we have our ceruloplasmin activity given in units per milliliter. We observed a time effect in which the ceruloplasmin activity increased as the pigs aged, whereas we did not see any treatment by time interaction nor any treatment effect from maternal vitamin or saline injection. Next, for the superoxide dismutase activity, we observed a time effect with a p-value of 0.0001, so very significant, in which the superoxide dismutase activity increased as the offspring aged from day 5 up to day 45. We also had a tendency for greater superoxide dismutase activity in offspring from sows which received the vitamin injection. And finally, for the glutathione peroxidase activity, we observed a treatment by time interaction with a p-value being 0.04. And to step back and to explain this a little bit, at day 25, the glutathione peroxidase activity was nearly identical for the offspring from sows receiving the vitamin injection compared to the control. Whereas from the period from day 25 to day 45, the offspring from control sows, the glutathione peroxidase activity increased at a much greater rate than offspring from sows which received the vitamin injection. Next, moving into the growth performance portion of this trial, here we have the effect of sow vitamin injection on offspring growth performance in the nursery phase, so from day 25 to day 45 of age. I'd like to take the opportunity to point out that the primary goal of this particular research project was the antioxidant enzyme status of the offspring, which due to the intense nature of the lab work, we weren't able to have as many pigs as we would have liked to build a strong story as far as the growth performance. But regardless, we did measure it and we did come up with some pretty interesting results even with this very limited number of animals on this particular trial. So on our x-axis, we have our 3 response criteria: average daily gain, average daily feed intake, as well as feed efficiency. And on our y-axis, for average daily gain and average daily feed intake, our units are in kilograms, whereas for feed efficiency, it's the ratio of kilograms of gain per kilogram of feed consumed. As you can see, we had a statistical increase in average daily gain as well as average daily feed intake in offspring from sows which received the vitamin injection. However, we did not observe any differences in feed efficiency. So in summary, offspring from vitamin-injected sows tended to have greater total superoxide dismutase activity. However, they did have lower glutathione peroxidase activity. Plasma vitamin E concentrations decreased over time regardless of treatment, whereas ceruloplasmin and SOD activities increased over time regardless of treatment. We observed no differences in feed efficiency, ceruloplasmin activity, or plasma vitamin E concentrations among treatments. However, average daily gain and average daily feed intake were increased in offspring from sows which received the vitamin injection. So to further summarize these results, we observed an inconsistent response from sows treatment on our measured antioxidant enzymes. However, we did observe improved growth performance post-weaning. So in conclusion, based on the results, we conclude that there were adequate nutrients for an antioxidant response in pigs from sows that were fed diets either meeting or exceeding the NRC 2012 requirement for dietary vitamin E. This lack of observed consistent antioxidant activity response suggests that it, in fact, was not the cause of the observed improved growth performance, and that the mode of action for this observed growth is unknown. Therefore, further evaluation of other components of the vitamin injection, I believe, are warranted to get some reasoning or to find some solid background onto why we did observe that improved growth performance.